Interdental cleaning is when you clean the gaps in between your teeth. You find that you've got your teeth, and between the two teeth, you've got a small gap in between each one. That area is called the interdental area. So it's really important to keep that area clean because you can get food, debris, stains in between those areas of the teeth. Usually when you brush your teeth, the toothbrush bristles don't go right in between the teeth. So you either need to use floss or brushes to clean this interdental area. Lots of people avoid flossing their teeth because they believe that when they floss, their gums start bleeding. The truth is that gums are bleeding because you're not flossing your teeth. What happens is that bits of food and debris get stuck in between your teeth in this interdental area, the gap in between your teeth, and it inflames your gums. So when your gums are inflamed, they bleed. One way to stop your gums bleeding and stop your gum disease is to floss and clean in between your teeth, either with floss or with the right interdental brushes. If you start flossing for the first time and you've not flossed for a long period of time, you're going to find that the gums in between your teeth are really inflamed because you've not done it and you've got so much plaque and build-up of debris in between your teeth. So when you first start flossing, you may be shocked because your gums will really start bleeding. But if you floss every day for 2 weeks, that's the amount of time that your gums will then need to, your gums to heal and become healthy again. And at the end of the 2 weeks, you'll then find that your gums are no longer bleeding when you're then flossing. You use floss in areas that are really tight, or you can use brushes in areas that are sort of more gappy and bigger. So this area in between your teeth, you can either have teeth that are very close together, or you can have gums that have receded up. In that case, you've got a bigger area in between your teeth, so the floss won't really remove all the bits of food and debris in between your teeth. You need to use a brush. If you go to your dentist will show you which brush is the best size, because you can get different size brushes depending on different size gaps in between your teeth. So your dentist can tell you which brush is best to use in between your teeth. You should floss once a day before you brush your teeth. So when you floss, you'll be removing all the debris from in between your teeth, and then you can come along with your toothbrush and remove all that debris away. So at the end, you'll have nice clean teeth and gums. I do think flossing is quite technique sensitive, whereas using the interdental brushes, lots of people find that a lot easier because you just literally need to, poke that in and out in between the gums. But brushes don't work for everybody, because if you've got really tight gaps, you're not going to be able to fit the brushes in between your teeth. It's only people with gaps that are large enough that would work for. So when people try to floss their teeth, they don't really know the correct technique for flossing their teeth. So they end up just sort of like jabbing the floss up and down, and they end up traumatizing their gums. So there is a correct technique as to how you're meant to floss your teeth, which is to wrap the floss around your fingers and put it in between your teeth, almost in a C shape, so that it follows the contour of your tooth up to the gum level. You then remove the debris in between your tooth and your gum, and then you come back out, and then you follow the contour of your tooth back on the other side. So essentially, it's two sort of C shapes rather than just jabbing it up and down. When you clean in between your teeth, you might find that when you remove the floss from in between your teeth, there's some debris on there that you've removed. If it's a long string of floss, you then sort of move on to the next piece of clean floss to do your next bit of interdental cleaning. Or if it's on a flossette or a handheld piece of floss, you can just wash that debris away, so you've got clean floss to go on to the next tooth until all your teeth are nice and clean at the end. So you can use the interdental brushes for up to a week each. But if they become splayed, broken, misshapen, then you discard them sooner than that. You get sort of handheld, pre-mounted floss sticks, and you can reuse them, like wash them and reuse them. But when they become broken, loose or misshapen, that's a good time to discard them and then get your next one. So now there are some more environmentally friendly options for floss available, things like silk floss and bamboo floss that you can look into as well. This is just a broad overview for interdental cleaning. It's best if you go to your own dentist or hygienist, and they will make you a personalised plan as to which floss areas to floss and which areas to use interdental brushes on that's unique for your mouth.